Hey everyone, I'm Linnea Batiste, one of the hosts for Lake Nona Social, and this is something new that we're trying to start right now, doing live interviews with people in our community. So this is something that we're going to start doing. So make sure you look out for it. But today we have a special guest, one of our own doctors here in Lake Nona, Dr. Felix, and he is going to talk about COVID-19. Of course, as you see behind me, I'm at my home, and just like all of you all right now, and all of us, we're at our homes. We're trying to practice social distancing and self-quarantining. And so I know a lot of you all have a lot of questions. So we thought, why not ask someone who is dealing with it on the front lines, who has a lot of experience and who could give us medical knowledge. So we will be opening up the floor to you all. You can ask the questions that are really on your heart. We will definitely get them to him. He is going to be answering them for you in real time. So again, this is Dr. Will Felix. He is with Advent Health. He is the director of sports medicine for Advent Health. He works here in Lake Nona, but he also is an ER physician. So he's double board certified, and he works part-time at the VA here in Lake Nona. So he knows a lot about COVID-19, and also he was recently tested for COVID-19. So he's going to kind of talk about that. But again, Dr. Felix, thank you so much for just being here with us tonight. If you could please, again, just give us another brief introduction about who you are and also about your test, your COVID-19 test, and how, we'll just say, interesting it was.
So, first of all, I'm a member of the community. I've been blessed to be part of this community for almost 6 years now. So, I feel like this community is part of me and I'm becoming part of it. I'm also a sports medicine doc for Advent Health. We started along with the community almost 5 years ago. So, we have seen how this community has grown and it grows on you too. So, as part of this community, I want to first thank you for giving me this opportunity to conduct myself, to talk to my community, because I still think there's a lot that we can do to make things better.
Perfect. So thank you so much again for being here. So let's just get right down to the nitty gritty. So you were tested for COVID-19. Talk about why you were tested and kind of like how testing goes. What can people expect if they're going to get tested?
Well, you would expect that because I work part time in the VA in the emergency department, that's where I would get exposed. Actually, I was exposed as my sports medicine practice by a patient who did not present any symptoms whatsoever. This person did not travel abroad, he did not have a fever. So, when we do that screening that we're doing lately on the clinical setting, just to make sure that we're not overly exposing people to those who have screened positive, who had a fever, cough, symptoms, etc. This patient had no symptoms. He did not travel abroad. He looked great. Vital signs were great. So I saw him for a sports medicine related complaint. So I spent about 10 to 15 minutes where I was fairly proximate to him without any personal protecting equipment. After that interaction, I received a phone call from the Department of Health saying that this patient identified me as a possible contact within 14 days prior to for him being tested, and for that reason, it was recommended that I proceed with the test. So my family and I did. It's not a pleasant experience.
Okay.
It's needed, but it's not pleasant. It's a piece of wire with a little tip, with brushy tip at the end that goes deep into the nostril and goes all the way to the back, almost to, well, it actually touches the oropharynx. So you feel that piece of metal going all the way through. Uh, it's an intense 3 minutes, but it's well worth it.
And as you said, the person you came in contact with had no symptoms.
Whatsoever, nothing. Thankfully, our results, we all came back negative.
I know, and that's such a good thing. And I'm so glad that you went and got tested. And I know that that's something that people have been worried about. Is it just like a swab of the mouth? So this is something that, is pretty, it's going to take something you're going to have to experience to really understand. But I'm glad you told that for us as well. But also, if you could just talk about, this stay-at-home order that we're under now. I know that this is something that was officially put in place yesterday. We've kind of already been practicing social distancing, but this stay-at-home order is for the next 30 days. Can you explain what that means and why it's important?
Well, it means that unless you have to go to do groceries, unless you have a doctor's appointment, but please make sure that you call your doctor as to whether or not that consultation can be done using telemedicine as a safe platform to avoid overexposure. Unless you are deemed, your job function is deemed necessary, then you stay home. Then you stay put. You stay safe. Um, Again, the question is whether or not this order should have been done earlier.
Mhm.
What matters is now what we can do from this point on. And I do agree that social distancing, especially when it comes down to being strictly enforced by a government, by a law, by a mandate, definitely enforces the possibility that we're not getting unnecessarily exposure to people who are very likely infected, like my patient, with no symptoms, and then potentially contaminating others that may manifest in a very severe way.
So that's definitely very important. And that kind of leads into my next question. As far as flattening the curve, we've heard that a lot. And I know we spoke earlier, and there's a lot of misinformation out there about what that means. So if you can just explain how this staying at home will help flatten the curve and what does that mean for not only us, but the medical community?
Well, flattening the curve, we've heard that so much. So when you have a graph, you have an x-axis and a y-axis, right? So one of those axes is the amount of beds, resources available in the hospital setting when someone gets sick.
Mhm.
The other portion of the graph are patients who get sick. Ideally, what we want to have is if a patient gets sick, there will be a bed, there will be resources allocated to that patient so that patient can get efficient treatment and
Okay.
hopefully correlates with a great prognosis. Now, if we have a surge of many people becoming infected and eventually getting ill, and if those that the amount of people that gets infected and gets really ill requiring medical intervention in a hospital exceeds the amount of beds, exceeds the amount of resources, doctors, nurses, then we have a true problem now. So, because then we will have a lot of people sick and limited resources. So, what's going to happen with that discrepancy? Unfortunately, we will not be able to provide the best care.
Yeah.
Uh, we cannot just pull out of magic beds and staff and doctors to commensurate the amount of people that over exceed the demand. So it's a very dangerous concept because then people will die
Yeah.
because they will not have the resources. There will not be enough beds. So when we talk about flattening the curve, it's making that proportion more even.
Okay.
So if we stay inside, if we stay at home and we do not get exposed, well, the chances of us getting sick will diminish. There will still be people who will get sick.
Yeah.
That's gonna happen. But what we're shooting for is that the amount of people who get sick commensurates with the amount of resources available in the hospital. We don't want to have that steep curve, right? When
Yeah.
we have a lot of people getting sick and very little resources. We want to
Yeah.
push that down so it pretty much is the same or even less.
Gotcha. And I know that recently one of my former colleagues just reported that in New York, Governor Cuomo was saying that for the first time today, they have more people leaving than they have people in right now. So that's a good that's a good thing for us to kind of look at for our future. And I know that's kind of what we talked about before this interview, what our future looks like and kind of predicting it off of what's going on around the country. If you could talk about just our area, Orlando, Orange County, when do you see the peak happening? And And what can we expect in these next coming weeks, just so that we are kind of prepared?
Well, according to statistics and these model prediction models, uh, our peak should come by early May,
Oh,
May the 3rd, May the 4th. So we're not out of the woods yet. And what you bring is very, very important. And this is something that Governor Cuomo has actually stated multiple times. You are looking at your future. What's happening in New York, what's happening in Washington State, what's happening in Louisiana, as our neighbors in Louisiana, it will happen to us. So
mhm.
the benefit that we have in the next couple of weeks is that we can learn, for better or worse, for what they're going through, and we can adapt and we can implement this stay at home. The fact that some of these bylaws, this stay at home bylaws, means that you can still go to the groceries. It does not mean that you need to do the grocery. You go to the supermarket every day. Go
Yeah,
once a week. Don't go in packs. Just have a member of your family, just one member going to the
yeah,
supermarket. We do not, the fact that we have those freedoms does not mean that we should abuse those freedoms. The
yeah.
best thing to do is to stay at home.
And before we continue, one of our Facebook users, they just wanted to know your background again. So if you can kind of just, for those people who are just logging in, just again tell them a little bit about yourself and your experience right now and knowledge with COVID-19.
Well, first of all, as I said, I'm a member of this community for almost 6 years. I'm a doctor, an MD. I did a residency specialty in emergency medicine in Camden, New Jersey. Eventually, I worked for a while as an ER doc, and eventually went back to school and I did sports medicine at Duke University. So for the past 7, 8 years, I've been doing mostly sports medicine. I recently joined the VA as a part-time emergency medicine doc. So yes, I have seen patients with COVID-19 in the ER. It is not a fun sight to see. It's very saddening. It's real.
Yeah.
It's in our community, and we should take action.
And so I know some people are often wondering if someone coughs or someone sneezes that they're scared that they may have COVID-19. Could you kind of talk about allergies versus COVID-19 and what does that look like if someone has COVID-19?
Well, under these very special circumstances, do not assume that what you have is an allergy. Usually, allergies are reactions to that our body, and some people, the body creates when they're exposed to allergens, when they're exposed to environmental factors, let's say pollen, dust, etc. Usually, we associate those with sneezing, uh, watery eyes, in some extents, even a cough. Rarely, it comes with a low grade temp, but mostly it's not associated with a fever. Now, under these circumstances, if you cough, if you have runny nose, and it doesn't feel quite, you don't feel quite well, do not assume you have the allergies. Pick up the phone, call your doctor, and make sure that you describe your symptoms. Very likely you will need a COVID 19 test to make sure that this is COVID 19 until proven otherwise.
And I also want to put out there for people who want to test, you can go to the Orange County Convention Center. It might be a long line, but they are testing there. We do have another question from one of our Lake Nona social community members. Are we seeing an increase of cases here in the Lake Nona area?
Well, I think, and I apologize because I cannot state exactly which website, but there is a website that you can track per county the amount of new cases. Uh, I do not think, to the best of my knowledge, as the last time I checked was today at 2 p.m., there were no cases in Lake Nona. But please, those are confirmed cases. Those are people who have been tested because very likely they presented symptoms. We know the incubation period for this virus can be quite lengthy, and still the virus can be shed on people who may not present symptoms. So we have to assume, we have to not assume, we have to attest that the virus is in our community. So please don't let your guard down.
Yeah.
Maintain that safety, social distancing that we're encouraging. Today, I went for a walk, and I could see how the community is actually embracing that concept. Everyone was in their own line, giving space. Um, so we have to attest that this virus is already in the community. It's just that we have not had a positive case yet. Yet.
Yeah. And also, just for everyone that just logged in, if you can kind of go back over your experience with getting tested, because the person that you came in contact with, you were notified by the Department of Health, they had no symptoms at all, right?
Which is the scary part about this virus, right? When we compare it to the flu, usually the onset of symptoms will start about 3 5 days after exposure tops. And usually those symptoms are fairly predictable on almost everyone: the high grade fevers, the cough, so on and so on. So it's easy to identify, right? Plus, with the flu, we have a vaccine, and we even have
Yeah.
medications. With COVID-19, the spectrum of symptoms can vary so much. And it's not an elderly disease. It's a young man, like I saw several weeks ago, who looked perfectly fine. It's just at that given moment he was not presenting symptoms. He did not have a fever. He did not travel abroad. So this is a community spread that it's here, and unfortunately it will continue to be in the community if we do not let it die. How do
Yeah.
we let it die? Well, the virus needs a host. You stay home and you are in the safety of your house, guess what? The virus will not
Gonna
have a host. So
stay home.
stay home.
And we just have another good question come through for you just now. Are masks okay to reuse if they sit for a few days? Shouldn't any of the virus on the mask be dead by then? So, what is kind of like the protocol with mask usage and then reusing them as well? Because we are in a shortage. I mean, if you can get your hands on one, you're pretty lucky at this point.
Well, I'm going to answer that question very carefully,
Okay.
because the CDC is potentially pondering the idea to recommend the use of masks or even cloth, which I think is silly, but I guess it's better than nothing, right?
Mhm.
Because it's a double-edged sword here.
Okay.
So if you are able to have a mask, you ought to know how to use it. It defeats the purpose of a mask if you fit it well. Second, you continue to touch your face just to accommodate the mask. Well, guess what? Now you're putting your contaminated hands in your face, increasing the exposure, right? Third, the mask is not a safety blanket. The mask should not be used to let our guard down.
Hmm.
So now, because you have a mask, now you're going to go out there and pretend like nothing is happening just because you're protected by a mask, which, again, the protection may vary on the quality,
Okay.
right? We heard about the N95s, we heard about the surgical mask, the R1s, which have conveyed a lesser amount of protection. Now, I and I say this very carefully because our healthcare providers, the people like me who are in the front lines, we are craving these equipments,
Yeah.
right? We in many cases, and I can't say that from my personal experience because I feel like both Advent Health and the VA are being very good at protecting their employees so far. Um, but I cannot say the same for my colleagues in New York. They're craving these masks. So we don't want to have a surge of people who are non healthcare providers consuming those resources that should go to the healthcare providers.
Yeah.
The best thing to do, once again, I'm going to repeat myself over and over again, is to stay home. Don't get a mask because you feel like you're going to gain some liberty and go out there because now I have a mask and I won't get sick. Stay home. Stay home.
And
Stay
what
home.
about, but if people are using masks, what about reusing them? Is that like, does that also defeat the purpose as well? I know that was one part of
Well,
her question or their question.
m- m- those masks are meant to be used as a one time only, right? We're telling some healthcare providers to use them on multiple occasions as long as they're not soiled. Um, there are very specific protocols to decontaminate a mask. And you can download a bunch of things in Google and YouTube that are not scientifically proven. Um, there are very specific protocols, very special equipment that is used in order to decontaminate those masks. So,
Gotcha.
as you said, a mask that is being used too much, the filter capacity will be lost, and it defeats the purpose. And it conveys, once again, a false sense of security at that point for someone who just wears it instead of staying home.
Gotcha. And someone else also asked, this person is an asthmatic pregnant person, and she's saying that should she be more careful since her husband has to go to the stores for them to buy things. So, what is your medical advice to her and her family?
Well, the thing about this virus is that we are learning so much from it. So the information out there is very fluid.
Okay.
The first thing I must say, if this person is asthmatic, make sure that you are on top of your asthma, right? I don't know whether or not you on an inhaled corticosteroid, one of those pumps to make sure that the amount of inflammation always stays steady. If
Yeah.
that's not the case, talk to your doctor as to whether or not that might be a good idea. um, Obviously, there's no reason for this person to go out there and be exposed.
Yeah.
Something that I'm doing is that I am cleaning everything that comes into this house, whether by
Yeah.
mail, even groceries. I'm cleaning it thoroughly. Anything that's plastic, I'm putting bleach or anything. Of course, you cannot do that with food, but
Yeah.
be very thorough into cleaning. And again, if the husband is doing the groceries, let the husband clean everything
Yeah.
so that this person who's pregnant, who happens to be asthmatic, is not
That's a good
unnecessarily
tip that you
exposed.
brought up. And let's kind of go over that because I know that's something that people worry about as far as if they get takeout food, if they're going to get groceries, worrying about the virus on like inanimate objects. What can you do to clean those objects? Is it okay? What's the protocol with that? And you kind of mentioned it right now. But if you can kind of go over that for some of us who may have to touch things outside of our home.
Well, necessity is the mother of all inventions.
Yeah.
And I know people are going into the internet exploring because they have the same concern. How do I decontaminate anything that comes around, right? Because you don't know who touched it. Um, I've actually came up with ultraviolet light, UV light, that has an intensity to
Wow.
mutate and degrade all the virus and bacteria. So, I mean, if you get a hold on one of those, it may not be a bad idea to use them, um, mostly on plastic and hard surfaces. Something that I'm doing with the boxes is that I prepare a solution of just Clorox bleach, diluted with water, and then I rinse it thoroughly with water just to remove the excess of that bleach. I do not let my kids touch it. So it's just me, only my wife and I handling those things to minimize once again the exposure. So anything within the resources that you may have, in order to, even if it sounds exaggerated, even if right now there's no science to back it up, because once again we're learning so much from this virus, it's better to be proactive than let our guards down.
And again, for anyone that's just joining, I'm Linnea Batiste with Lake Nona Social. And again, we're here with Dr. Felix. He's with Advent Health. He's a sports medicine doctor and an ER doctor as well. He works right here in Lake Nona and also for the VA hospital. So he is on the front lines. He is taking your questions, any type of questions you have about your personal situation or about COVID-19 in general and how it's affecting our community. Please send those questions through while he's with us right now. It's so great to have him with us, and he's talked about being tested for COVID-19 and also the stay-at-home order. So for those people who are just joining again, we're just kind of recap again your experience with COVID-19 and being tested. But I also just want to know how's the emergency community feeling right now? Like some of your friends and colleagues just express some of their concerns. I know you all probably have your own conversations. So if you can kind of give us insight as to how they're feeling right now.
Great question. We're terrified. We are terrified. Uh, we made an oath to serve those who need and who need our skills. And I've been blessed to be a doctor for so long, and so does many of my colleagues. They're very blessed to do this, and we will not hesitate to go in the front lines and fight in battle. But I never we many of my colleagues never expected to go to a battle without arms,
Yeah,
without the rifle, right? Because it's a certain death if we do not have the proper equipment, the proper tools. Right, it's also a risk for the patient. Now, right now in Florida, we're not getting hit hard, but we will soon be there, like New
yeah,
York. But that's mostly the complaint and the feedback that I get from my colleagues, mostly in the north. But overall, we're terrified. We don't want to bring this disease to our family,
yeah.
right? So we are I haven't hugged or kissed my kids in almost 3 weeks.
Ah,
And again, it breaks my heart, but I'll do what I'll have to do. I'm basically almost isolated, even in my own house. I'm going to be somewhat graphic. I strip almost naked in my garage,
yeah,
and I'm not alone. I put detergent in my sneakers and on the sole of my sneakers. I almost bathe in the garage, and then I run into upstairs and I shower 3 or 4 times in a row. And even to that point, do not hug or kiss my kids or wife, just because I'm still concerned, even though I just tested negative. Um, as early as next Saturday, I will be in the front lines again. So
yeah.
it's just the nature of the beast.
So we had another question come through, and I'm not too sure if you can answer this. So I'm going to pose the question just to give respect for those people who are asking questions. But they just wanted to know about, as far as the VA, were there any nurses or people who tested positive? How many? I'm pretty sure we probably, if we even had that information, we couldn't
No.
talk about that information. But I wanted to pose that question as far as that concern. So for anyone who's asking specific questions like that, that is a sense of privacy. We wouldn't have that knowledge, but even if we did, just for the laws of the medical community, you can't say if someone was tested positive. That would have to be something that they announce on their own.
Yes.
Just to put that out there for any further questions. But someone else came through and said they have a friend that's a nurse at the VA hospital, and their heart goes out to them as well when you were talking about your experiences with your friends as well.
Thank you so much. I'm very humbled. This is a very humbling experience. Uh, the, Even with all the knowledge and the school and the years devoted to this career, in the search pursuit of knowledge, you're never ready for something like this. This massive that hitting us at so many different locations at the same time. It just exposes how vulnerable we are, how much we need our community, regardless of any differences that we may have, right? We need to come together in this. We
Yeah,
need to have one same train of thought. The train of thought is stay home,
yeah,
be safe. If you don't need to be out there, please don't. This is not this is not the press overblowing a story for the sake of popularity.
yeah,
This is real. This is no longer a disease that attacks the elderly or the immunosuppressed. There are young people dying. There are doctors dying. There are people who were otherwise healthy dying. Why some people die and some don't, we still don't know. We do not have a cure yet for this disease. We do not have a vaccine. We're experimenting with different drugs. And again, you may hear many versions out there,
yeah.
uh, but we're still in this trial and error. And it's very humbling that we are faced in this century, right, with something so massive, and we are yet so powerless.
And again, I'm with Dr. Felix, and there's a lot. You have a lot of fans out there. They're saying you're the best, and they say you're a hero, and just thanking you. Someone just now said that they're a RN themselves, and they express their appreciation to you. So, what is something that you would like to say to the community? Because so many people are just going through right now, and everyone wants to find a way just to say thank you to you all. So, what is something that you would like to say to us Lake Nona residents?
Thank you. Um, my wife had a great idea, actually. She cut some hearts and like cardboard hearts, and people were posting them on the in their windows. And I'm sorry.
No,
Oh
it's
my
okay.
gosh, I'm so sorry. Um, when I was walking today, just because I needed to breathe some clear air, um, I saw many of them in the windows. And again, it doesn't take away the fact that we're facing a very scary virus out there, but you don't know how much that means to not only doctors, nurses, paramedics, firefighters, police officers,
Yes, everyone.
personnel from the supermarket, from Sam's, Publix, you name it. They are also heroes, and we need to be grateful to them. In some instances, they're not even protected by at all. So, and because of them, we have the food in our tables. So we also have to be grateful for them. So I, the best way to do a homage to people like me who serve, to anyone who's out there in the front lines, the best way to honor me and my colleagues is to stay at home.
Yeah,
It's to stay safe uh, and keep praying for us because we're all for the long haul.
I agree. And that's the least we can do because, we really thank you all because you're literally out there. And like you said before, guys, this is what they pledged their lives to. And we're seeing them act out this pledge. So
Hmm.
even from my heart, I definitely want to say thank you. Again, we're with Dr. Felix. He's a Lake Nona resident. He's also a sports medicine and an ER physician. So he's double board certified, but he's on the front lines.
Hmm.
He has seen people with COVID-19. Thankfully, he has been tested negative, but he's been tested for COVID-19 after being exposed to someone who presented no symptoms. So
Hmm.
that's one thing we really want to drive home is the no symptoms. Another question that I have personally, you kind of touched on it before about the mask. So we've been seeing this whole thing. If you can't find a mask, make a mask. Get some cloth, make a mask. And I want to know your thoughts about that. You kind of touched on it before as far as wearing masks and maybe why that might be an issue. So I just kind of want to know what are your thoughts about people making their own masks?
Well, because standards and quality and consistency, right? Um, we believe that many of these masks that we obtain, they meet some criteria, they meet some quality standards in order to convey the same results over and over again. So when people make their own, right, I guess you can argue that it's better than nothing.
Yeah.
You cannot attest whether or not that will convey the same, less or more protection that one that has already been made, one that has already been tested in the industry that meets a certain criteria, right? But most importantly, the fact that it could convey a false sense of security, it's what really worries me. Uh, the point of the mask is to avoid is to avoid getting overly exposed, I guess. But it defeats the purpose. And I'm going to repeat this again because we touched bases before. If you don't know how to use it,
Yeah.
if it's not the proper fit, if you continuously touch your face in order to accommodate the mask in your face with your contaminated hands, then you're pretty much putting the virus pretty much where it needs to go, the airways, right? So I guess it's better than nothing. Be careful on the resources that you search. to search for guidance as to how to create your own mask, I have a better solution. Stay home as much as you can.
Yeah.
Stay home as much as you can. Keep your distance. Keep those 6 feet out, right? We're learning more on this virus, right? That we're learning whether or not this virus remains as particles in the air for an X amount of time. An experiment was done in the lab as to whether or not it extrapolates to real life. We don't know yet.
Hmm.
Once again, the information here is so fluid, it changes every day. So as we wait for more data, there are lives that can be saved. And the best way to do it and the simplest way to do it is just to stay home.
And I agree with you. And I also want to tell everyone that just joined in, if you have any questions for Dr. Felix, while we are so gracious to have him right now, please put your questions through. I will be asking those questions on your behalf. So while we are able to speak to a doctor and we can get the actual facts and to learn more about this virus, send those questions through. Before we end, I kind of want to just go through our questions again for whoever just joined, just so we can drive this point home. I think it's very important that, knowledge is power, and
Mhm.
you're giving that to us right now, and that's just priceless. So again, if we can just we're just going to circle around from the top, just talk about why you were tested for COVID-19, and if someone were to get tested, how would that go? Just talk about the COVID-19 test.
Well, I was exposed to a patient of mine, not in the emergency department, but in my sports medicine clinic, uh, asymptomatic, meaning no symptoms whatsoever. When this whole thing started, we implemented screening methods prior for the patient to coming into the lobby, even from in the place that I work, uh, to stratify those who were potentially sick and those who were not. So we were screening them. We were asking questions whether or not they travel abroad, whether or not they had symptoms like cough, fevers, etc. So this patient that I was seeing in my sports medicine clinic, not the ER, screened negative for all those questions. He did not have a fever. He did not travel abroad. We took his vital signs, and he was perfect. And I saw him for an orthopedic sports medicine complaint. So I spend more likely like 10 to 15 minutes of close contact with him within 3 feet. I was not wearing protective gear because at that moment that patient did not meet the criteria for us to be geared. So about 10 days after that interaction, the Department of Health called me
Okay.
stating that this patient that I've seen uh, tested positive for COVID. And I was identified as one of those close contacts in the 10, 14 days previous to that test. So it was highly encouraged for me since I was not wearing the protective gear to be tested. So my family and I got tested. A metallic deep brush that goes deep into the nostril all the way back to the oropharynx as a swab just to get a deep sample from the oropharynx,
Whew.
and then that's sent to the lab. It's not a pleasant experience, but please don't be afraid of it if you
Yes.
present symptoms because it can definitely save lives.
Exactly. We have a question that just came through. Are people experiencing a rash due to COVID-19? This person says they are a flight attendant and they had a coworker that tested positive and had a rash. So if you can talk about that.
I'm not surprised. I am not surprised. There were people who. So to answer your question, it could be. Uh, that's the nasty thing about this virus in comparison to the common cold, in comparison to the flu. So people who get the flu, even if they get vaccinated, if you get vaccinated, your symptoms will be much less than someone who never get vaccinated for the flu. But the pattern of symptoms tends to be the same and consistent. Sudden onset of fever, nasal congestion, the headache, the the body aches, and so on and so on. This virus, the spectrum of presentation can vary so much, so much. There are people who are only presenting with diarrhea, no fever, no runny nose, no coughing. They just presented with diarrhea. And guess what? They had COVID-19. There were people who were, and this is actually a tale from New York, uh, who were seen because of trauma. They were involved in a motor vehicle collision. They went to the trauma bay. They were getting scanned all over the body just to look for injuries to the body. And incidentally, they saw these patchy infiltrates on the lungs, which are what we're learning now are classical presentations of a COVID-19 pneumonia. And guess what? They had the COVID-19. They were not presenting any symptoms. So we are learning so much from this virus. I am not surprised that this patient presented with a rash and happened to test positive for COVID. Maybe not. Maybe they had another symptom. Maybe not.
Yeah, that's interesting. Well, someone also asked, what's better to use, bleach or Lysol?
As long as it kills 99.9% of bacteria and pathogens, use it. Do not mix two products, right? Stick with one product. Do
Okay,
not be mixing bleach and Lysol, because then you're going to get a toxic bomb, and then you will go to the ER for unnecessary reasons.
gotcha. So choose one and then use it efficiently and use it right.
You read the instructions.
Exactly. Read the instructions on the back that tell you everything on how to use it properly.
Mhm.
Also, just going back to some of the questions that we spoke about earlier, to really talk about flattening the curve and why staying at home will do that.
Well, it's about the people who get sick and how many resources are available to those who get sick. In the ideal world, there should be more resources and less people becoming sick or infected. So there's always capacity, there's always availability for someone who gets sick to be treated efficiently. So if suddenly a lot of people get really sick, requiring intervention in the hospital, whether or not it's just a regular bed or, in the worst case scenario, an ICU bed. If you suddenly have a flash, a mob of people getting sick,
Yeah,
then very likely they will, uh, in comparison to what's available, they will surpass the amount of resources. And
gotcha.
then what's going to happen to that people? Well, if there's a finite amount of resources and there's so many people sick, unfortunately, the quality of care that they will receive will be very, very compromised. It could be life or death. So what
So
we want to
flattening
do,
the curve works for all of us, even if
absolutely,
we need it at a certain time.
absolutely, absolutely. So the point about flattening the curve is when you stay home, you are number one, diminishing your odds of getting infected. Number two, if you will happen to be one of those asymptomatic carriers, people who do not present symptoms and yet they're infected with the capacity to transmit the disease, then if you stay home, you will not infect others who may be more vulnerable than you. Number three, and I didn't touch bases on this, but I think it's a very peculiar concept, is the concept of viral load. How much virus do you consume? If you
Mm,
happen to be sick, and you are overly exposed over and over again to that viral load, to that amount of viruses, then there's a great chance that you may get sicker. Is one of the theories that have been placed out there to justify why there's so many healthcare providers who were healthy otherwise getting really really sick or even dying, and it makes sense that they're getting exposed over and over again to the amount of virus that is on a specific setting, like the ER, like the intensive care, and so on. So that's the importance of staying at home. So we want to make that curve flat. We don't want to surpass the resources. We want to make sure that there are enough resources so when people get sick, they will be treated and increase their chances of survival.
and allergies, the flu, cold, or COVID-19? How can we tell?
At this stage, if there's symptoms that may mimic an allergy, assume assume that it could be COVID-19, because again, the spectrum of how this disease presents overall and person by person can vary so much. So my biggest concern with, so but please do not show up in packs in the ER. If you're stable, if you're not having difficulty breathing but you have a low grade fever and you're sneezing and you're coughing, call your doctor first. You will be amazed how many doctors already are implementing, institutions like Advent Health are implementing ways to optimize the use of telemedicine.
Okay,
So
yeah.
you are not risking yourself or exposing others. Uh, Orders can be done online, and you can go. Actually, we have several centric cares that are doing drive-throughs, and that's the way that my family got tested. We did
Okay.
not even. We were assigned. The doctor put an order. We did this by telemedicine. The order was sent directly to the central care, the urgent care. That urgent care called us within a matter of 10 minutes. You have been assigned to this place at this given time.
Interesting.
So
Okay.
we went there, and like a drive-through, there were people outside. We did not have to go. We didn't even have to leave the car. There were techs properly dressed in their protective gowns in a very sterile fashion, sampling my kids and my wife. And the process took about 10 minutes, and then we were out.
Yeah.
So instead of, if you have symptoms and you do not have difficulty breathing, which is the most important thing that we're following as to make that decision whether or not someone needs to seek
Mm.
care in a local hospital, uh, call your doctor, call the urgent care, local urgent care, so you can go through that screening, and then they can monitor you. But to answer your question, we have to assume it's COVID-19 until proving otherwise.
Exactly. For everyone else out there, I'm Linnea Batiste with Lake Nona Social, and we are with Dr. Felix, and he is a Lake Nona resident. He's also a sports medicine doctor with Advent Health, and he's also an ER physician for the VA hospital here. So he is giving us some great tips, some great information. Um, I just want you, again, so many people are just coming through just to say that they just want to thank you. They're
Oh,
saying you're great, you're amazing, a blessing, all of the above. And this is their way just to say thank you, because you are out there and you're helping to keep us safe, educate us. I mean, you're there on the front lines, but you're also here with us tonight educating. So you're doing so much. So what is just something, again, you would like to say before we wrap up to everyone watching out there and to our Lake Nona community, from the bottom of your heart?
thank you, thank you, thank you. Um, the best way to honor me, to honor those who put their lives on the line. And we keep thinking about healthcare providers. We keep thinking about doctors. We keep thinking about nurses. Think about the paramedics. Think about the police officers. Think about the firefighters. Think about that supermarket employee who's stacking the aisles with food, the food that you have on your fridge. Think about them and have them in your prayers. Be considerate. Say thank you. They are the unsung heroes. Um, the best way you can honor us is by following the guidelines that we are insisting so much, and it's very simple.
Yeah.
If you don't need to be out there, don't be. Stay home. I know it's difficult. I have 3 children, and it's difficult to be on top of all the activities they want to do, but it's life saving. This is a very unique moment in history, and we're gonna pull through, and we're gonna go through this, and we're gonna defeat it, and we're gonna win. But in that process, we need to be disciplined. In that process, we need to stay home.
Well, someone else just came through and said you're the best doctor in Lake Nona, so I definitely want to pass on
Nah,
that compliment. And
thank you.
someone else said they have one more question. What is the turnaround time from the time that you get tested until you receive the results?
Great question. My turnaround was 4 days,
Okay.
but now they're coming up with 5 minute tests, 45-minute tests. Um, so the waiting time will be much less than that, hopefully, very soon.
Well, that would be awesome if that can happen. And again, for anyone that's watching out there, we're with Dr. Felix. He gave us a little chunk of his time to come speak with us. Of course, he is a sports medicine doctor with Advent Health. He's also an ER physician with the VA hospital. But you also brought up a good point. We want to say thank you to everyone out there who's working, all of our supermarket workers, people at gas stations, also our daycare workers. There's so many
Right.
people who have kids who are medical professionals who have to be there helping us. So someone has to watch their kids. So we want to say thank you to everyone out there, and really just keeping those necessities open for us. That's just from Lake Nona Social. We want to say that. And if there's anything else, Dr. Felix, that you would like to say, again, we thank you for being here. I've learned a lot. I thought I knew some things. You actually taught me even more, even though I've been on Google trying to figure out everything. So I really appreciate it. But again, just anything else, of course, we say thank you.
I apologize for what happened before. the Hispanic in me who gets a bit emotional. But going back to that detail that people are putting their hearts for thanking healthcare providers, that goes a long way. Um, the best thing you can do, once again, to honor us, those who serve, and it doesn't have to be just doctors or nurses or those who put their lives out there to serve you, is to stay at home and be safe.
And I think those are great words to end on. Again, Dr. Felix, thank you so much. Our prayers are with you at this time as you continue to serve our community. And thank you again for educating us and opening our minds and our hearts to what's really going on and how we can continue to keep ourselves and our families safe. Thank you so much. And everyone out there, thank you for joining us. Again, we are going to be doing some other live reports just with other businesses in the area, just to continue to give you all content as we're all social distancing. As you can see, Dr. Felix and I are in our homes, just like you all are in your homes. So any ideas that you have, please send them our way. We would love to engage with you and speak with you. And someone else just came through and said he took care of me at the VAER. He is great. He's amazing. And I'm so
Thank
glad
you.
you all are coming through, because those compliments, as he says, they go a long way. So you all have a wonderful night and stay safe. Thank you, Dr. Felix.
Take care.
Bye-bye.